improvements in cardiovascular outcomes during the past few decades in the general population and in people with diabetes, we don't know very little about whether different socio-economic groups benefited equally from these advances. So the main aims of this nationwide study were, firstly, to describe trends in hospital admissions for major cardiovascular events and procedures in England between 2004-05 and 2014-15. And secondly, we also aim to assess whether the absolute and relative inequalities in these outcomes have changed during the past decade. So we identify all patients over the age of 45 years with diabetes in England who were admitted to hospital between 2004-05 and 2014-15 for acute myocardial infarction, stroke, coronary artery bypass graft, or percutaneous coronary intervention. We used hospital episode statistics data. These data covered the entire population of England treated in NHS hospitals, including private patients treated in NHS hospitals. We calculated age and sex-specific admission rates, and to do this, we obtained data on the number of people with diabetes in England for each study year. We used the GP's diabetes registers under the Quality and Outcomes Framework scheme that covers virtually all general practices in the UK. We defined deprivation quintiles based on index of multiple deprivation scores, which is a small area statistics based on the area characteristics of the area where people live. And it's the most commonly used method to assess socioeconomic status in England. So I'd just like to focus on the main results. And these figures show the changes in the age and sex standardized admission rates for the 4 outcomes by deprivation groups. And what I'd like to look at is that there is a very consistent and clear socioeconomic patterning of outcomes, of admission rates, with a gradual increase in admission rates as we move in from the least deprived to the most deprived quintile. And this was consistent across all outcomes throughout the follow-up time. So for myocardial infarction, there was a decline in admission rates in all socioeconomic groups up until 2010, and there was a flattening out of trends in all groups. For stroke, there was an upward trend, a slight increase in admission rates in all groups during the study period, except for the most deprived groups. For CABG, there was a consistent decline in all groups, and for PCI, there was an upward trend in all socioeconomic groups. First, we looked at how absolute differences, absolute inequalities changed. So we looked at whether this gradient that you can see here between the least and most deprived quintiles changed over the study period. We used linear regression models just to compare the changes in this gradient. And we found that there was a slight narrowing in absolute inequalities after adjustment for age, sex, and study years for stroke, CABG, and PCI, but we couldn't see a decline in absolute inequalities for acute myocardial infarction. We also looked at relative inequalities using negative binomial regression models, and we found that people who live in the most deprived quintiles had 1.9-fold increased risk to be admitted for an MI and stroke, and they also had a 70% increased chance to get admitted for CABG, and an 80% increases for admitted to PCI. We also looked at the interaction for the IRRs between mere and deprivation, which basically looking at are the annual changes differ in different deprivation groups, and we didn't find a significant difference indicating that these inequalities persisted throughout the study period. So in summary, socioeconomic inequalities existed in major cardiovascular events and procedures and hospital admissions in England during the past decade, which highlights that we need to do much more to tackle these inequalities, and this includes taking into consideration the socio-economically defined risk when we are looking at individual risk categorization, but also we need population-wide and wide-reaching public health policy to be able to tackle and change risk factors at the population level to reduce inequalities. Thank you for your attention.